Hey there, welcome. I'm so thrilled you're joining us. Today's explainer is going to completely change the way you think about energy, aging, and overall wellness. We're going to fully demystify IV therapy and look at it as the ultimate biological reset for optimizing our cellular biology. So let's dive right in. So why are you always tired? Man, it's a question we literally ask ourselves every single day, right? Usually around 2 in the afternoon when that intense, heavy brain fog rolls in. I want to validate that fatigue for you right now. If you're constantly exhausted, you aren't just thirsty, you are cellularly parched. Even if you're chugging a gallon of water a day, your body is likely struggling to actually use those nutrients. You're essentially operating at a mere 60% capacity and just assuming that feeling fine is the same thing as being healthy. Spoiler alert, it really isn't. Here's a quick roadmap for our explainer today. We'll start by unpacking the bioavailability crisis. Then we'll explore fueling the cellular engine, beauty and immunity, closing the recovery gap, and finally, investing in longevity. We're going straight from the microscopic root cause of your exhaustion to a highly practical long-term longevity solution. Section 1. The bioavailability crisis, bypassing the digestive gauntlet. We absolutely need to talk about why those expensive oral supplements you're diligently swallowing every morning are, unfortunately, largely going to waste. Okay, let's look at the harsh math of wellness. When you swallow a pill, your body has to work incredibly hard to break it down. Honestly, you're lucky if you absorb just 20% of the active ingredients. A massive 80% is completely destroyed by what we call the first-pass effect. Basically, the moment that supplement hits your stomach, it's assaulted by highly acidic gastric juices, and then it's further broken down by complex digestive enzymes in the liver before it ever has a chance to reach your systemic circulation. You are literally paying for nutrients that your cells never even get to use. Think of your gut as a literal digestive gauntlet. It's filled with stomach acid, bile, and highly inefficient absorption pathways that just brutally break down everything you consume. Now compare that harsh environment to the pure efficiency of the intravenous route. By delivering vitamins, minerals, and hydration directly into the bloodstream, we entirely eliminate the middleman. You bypass the gut completely, resulting in 100% absorption. No waste. This pure, unadulterated efficiency delivers vital resources instantly to the mitochondria in your cells, exactly where they're needed most. Section 2. Fueling the cellular engine. Let's shift our focus to how our bodies actually create true, sustained energy, rather than relying on those temporary, jittery fixes we usually reach for. There's a great saying, fatigue is a symptom, not a personality trait. Treating it with caffeine is like whipping a tired horse. I mean, sure, it might get you moving temporarily, giving you that quick spike in heart rate, but it only masks the underlying exhaustion. Once that caffeine wears off, the crash is inevitable, right? True vitality requires actually fixing the metabolic engine from the inside out, not just artificially stimulating a biological system that's already depleted. And that brings us to ATP, or adenosine triphosphate. This is the primary energy currency of the human body, created right inside your cellular mitochondria. Think of mitochondria as tiny little power plants inside your cells, and ATP is the electricity they generate to keep everything running, from your basic heartbeat all the way to your higher-level brain function. If your body doesn't have the specific raw materials to make ATP, well, your cellular batteries simply cannot run. It really is that fundamental. You just can't generate internal power out of thin air. So, to generate that power, your body requires a highly specific energy blend. First up, B-complex vitamins are absolutely crucial. They surge your mental clarity and physical stamina by helping convert the food you eat into usable cellular fuel. Next, we have B12, which heavily boosts your overall neurological function. And crucially, getting B12 via IV entirely bypasses the stomach absorption issues that genetically predispose so many people to a severe deficiency in the first place. Finally, magnesium. Delivering magnesium intravenously acts as a powerful vasodilator. It actively shifts your nervous system out of that stressed-out fight-or-flight mode and into a totally calm rest and digest state. It induces a deep, profound physical relaxation from the inside out that you just cannot achieve with an oral pill without, experiencing severe digestive upset.
Now, all of this builds up to another incredibly critical molecule, NAD+. Nicotinamide adenine dinucleotide is a vital coenzyme for mitochondrial health and essential DNA repair. The underlying problem here? Your natural levels of NAD+ drop by a staggering 50% by the time you reach middle age. It just plummets. Introducing an NAD+ booster like Niagen through IV therapy acts as a biological refresh button for the mind. It literally helps your cells repair themselves at the genetic level, effectively combating the silent modern epidemic of brain fog and cellular aging.
Section 3. Beauty and immunity. We're moving from internal energy production to the external and defensive benefits of optimal cellular health. Because what happens on the inside directly impacts the defensive shield we build on the outside.
Take glutathione, for example. It's often referred to as the master antioxidant. It neutralizes free radicals, detoxifies the liver, and noticeably brightens your skin. Now, the beauty industry spends billions trying to convince you that you need a $200 face cream to look younger, but true beauty actually requires cleaning up the oxidative trash inside our cells, those metabolic byproducts that directly cause wrinkles and inflammation. Glutathione is a highly sensitive tripeptide that's notoriously difficult to absorb orally because stomach enzymes almost entirely destroy it. That makes the intravenous route the absolute gold standard for flushing out cellular toxins and achieving a genuinely vibrant, hydrated glow from within.
Let's look at another heavy hitter for both skin and immunity: vitamin C. Taking oral vitamin C is severely restricted by what we call low bowel tolerance limits. Essentially, if you take too much orally, your stomach intensely rebels, causing pretty major gastrointestinal distress. But IV vitamin C, it completely bypasses those limits. This allows us to safely flood your system with the massive, therapeutic doses required to synthesize collagen for your skin's elasticity and to massively boost the lymphocytes for your immune system. Pair that direct infusion of vitamin C with zinc, and you've effectively built a proactive biological shield against viruses and everyday infections.
Section 4. The recovery gap. If you've ever wondered how high-performing athletes bounce back so quickly from intense physical stress day after day, well, this exact clinical science is their secret weapon.
The recovery gap is defined as that crucial window of time between your last rep in the gym and when your body's 100% ready to go again. When you work out hard, you are actively creating microscopic tears in your muscle fibers and generating severe lactic acid buildup. It's this exact biological debt that keeps you intensely sore, fatigued, and glued to the couch the next day while your body struggles to patch itself back together.
So how do we actively close that gap? It all comes down to specific, targeted amino acids used in advanced recovery blends. Let's break them down. First, glutamine is essential because it stimulates the release of natural growth hormone, paving the way for muscle synthesis. Then there's arginine, which acts as a powerful vasodilator to speed up localized tissue repair by increasing blood flow. And ornithine flushes out that stubborn lactic acid buildup, significantly reducing delayed onset muscle soreness. Delivering these specific amino acids intravenously allows serious athletes to recover in record time, train much harder, and hit their physical goals far more frequently.
Okay, so we've covered a ton of deep biological science today, but practically speaking, what does a medical-grade IV experience actually look like? If you were to walk into a specialized clinic today, what should you realistically expect?
While the clinical standard at any industry-leading facility is a strict, highly regulated three-step process. Step 1 is a rigorous health assessment and consultation with a certified medical professional to evaluate your current vitals and medical history. Step 2 is the creation of a custom formulation specifically tailored to your unique biology, because when it comes to cellular health, one size fits absolutely nobody. And Step 3 is a 45 to 60-minute relaxing drip session, usually kicking back in a massage chair where you just let the science do the heavy lifting. Strict safety protocols, sterile techniques, and extreme personalization are absolutely non-negotiable at this level of care. Section 5. Investing in longevity. It's time to conclude our explainer by reframing IV therapy entirely. This isn't just some quick hangover cure or a trendy spa treatment. It is a critical long-term longevity play.
It really all comes down to proactive maintenance. Think about it. You wouldn't wait for your car's engine to completely seize up on the highway before deciding it's finally time to change the oil, right? So why on earth would we wait for our bodies to break down, get sick, or become chronically exhausted before giving them the essential nutrients they desperately need? It is infinitely easier and far more effective to maintain optimal health and reduce cellular wear and tear proactively than it is to try and painstakingly recover it after the damage is already done.
I want to leave you with this final powerful thought. Stop settling for 60%. The future of health isn't in a pill bottle, it's in your veins. It's time to fuel your body correctly and give your cellular mitochondria exactly what they are screaming for. So, what steps will you take today to optimize your own biological engine? I hope this explainer has sparked your curiosity to explore cellular wellness further and totally rethink how you approach your vitality. Keep learning, keep optimizing, and thank you so much for joining me today.